this video, we're going to talk about the disc and how the disc changes in relation to a problem with a segment in the spine, like a subluxation. So first off, if you remember, this is the front, this is the back of the spine. You have a bone, disc, bone, nerve comes out in between, spinal cord runs down the middle. So if you take this, I drew it up here so you can see bone, disc, bone, and I'm going to explain some of these structures, but what can happen with trauma is the bones in the spine can shift out of alignment. It shifts backwards, and it will usually tip down, so go backwards and down if it's in the lumbar or cervical spine, so in the neck or the low back. It's a little different if it happens in the mid back, but what will happen is it tips backwards and down, the disc swells up, it can irritate the nerve. Let's talk a little bit more about exactly what happens with the disc. This isn't going to cover every single variable out there because there's many variables. This is like a very broad overview, just so you can see that a disc herniation or a disc bulge, a problem with a disc, happens secondary to misalignment or improper motion of a segment. So what that also means is that a disc problem always stems from a subluxation initially. Okay, so let's jump over here and look at that in a little more detail. So right here in a normal scenario, you have a bone, you have a disc, you have a bone, and the disc is fairly parallel, fairly level. Now, if it's in the neck or the low back, there can be a little bit of wedging, so a little bit of decreased space in the back compared to the front, but for all practical purposes, a level disc is the healthiest scenario that we're looking for throughout the spine. The center part of the disc, that little pivotal ball bearing, is called the nucleus propulsus, and that's what this body of the vertebra and this one below, they pivot on that little ball. It should be right in the center of the vertebra, right here. And then back here, that's the spinal cord, and then that's a spinal nerve root. And this is a side view, so this is the spinal nerve root coming out on the right side. There's one going out on the left side as well. You have 31 pairs of spinal nerve roots that start from the base of the skull all the way down to the tailbone in the lower back. And what can happen is that you can see that close proximity of where the disc is to where the spinal cord and the nerve root is. Where things go wrong is that trauma causes the bone to misalign. That's a subluxation. So the bone misaligns backwards and down, and the disc starts to get deranged. And what happens within the disc is the nucleus shifts. Usually that nucleus will start to shift forward, so that little pivotal ball bearing starts to shift forward, and then there's all these rings inside the disc called annular fibers. And it's kind of like a golf ball. If you've ever taken a golf ball and cut it open, you'll see all these rubber bands that wind around. That's how our discs are put together. Is you have all these bands of annular fibers that make up this piece of cartilage called your disc. And so that nucleus moves out of center, starts to stretch those annular fibers. The annular fibers swell up, and there's a big ligament in the front of the spine here called the anterior longitudinal ligament, the ALL. That pretty much prevents the disc from pushing forward all that much, but what that also does is it increases the pressure within the disc, and the pressure has to go somewhere, so it goes to the area of least resistance, which unfortunately happens to be backward and to the side into a spinal nerve root, like I'm showing here, backward to the other side into the other spinal nerve root, or straight backwards into the spinal canal hitting the spinal cord. So these are not great situations to have. It causes nerve compression. So I put a little star here and a lightning bolt because it's going to affect wherever that nerve controls. Now, the interesting thing is that you can have a disc problem, a disc bulge, compression, and have no pain. You can have zero pain at the actual injury site. However, it's just affecting the nerve going into the arm or going into an organ, for example. This is stuff we see clinically all the time. So presence or absence of pain doesn't necessarily let you know if you have a problem, if you have a subluxation, or if you have a disc issue. The way we figure this out clinically is doing an exam and different findings and just a whole multitude of things that your doctor is going to go through with you to identify, do you have something like this? And then it's determining, can this be handled conservatively? And fortunately, in the majority of the cases that we see, as long as they're not too far gone, these things can be handled conservatively, where if you reverse this scenario, so you affect the joint, you start to get that joint back into a healthier position, improve the motion in here, allow the disc swelling to start to come out. The disc is avascular, it doesn't have direct blood supply, so it depends on proper movement in between one bone and the next to squeeze and flush waste products out and pull nutrients in, which keeps a disc nice and healthy. That's also the way that when you get in an inflamed situation like this and the bone is misaligned and stuck and the joint's not working properly, that's what keeps that disc in a pathological or an abnormal state and allows the disc to continue to get worse, which then eventually leads it to be like a surgical intervention. So now with this said, we've been talking about how a segmental problem affects the disc, the actual bone misaligns, but remember the posture also affects this. If this is your low back and your rib cage is shifted backwards and you have too much curve in your mid back like this, your low back is going to be affected because your entire upper body weight is shifted backwards. That's going to really want to force that bone to sit backwards, compress the back part here, irritate the disc even further. So fixing the posture actually plays a role in the intersegmental disc problem as well. So that's where the segment and the posture play a role in the disc. And then movement-wise, if you're going through repetitive abnormal movements, you're lifting the wrong way, like let's say you're bending forward to pick something up and just folding at the lumbar spine versus actually hip hinging and moving through the pelvis, then even when this joint starts to become healthier and gets fixed with what your doctor's going to do as far as their intervention with the segment and the posture, your movement may be so faulty that you just go right back to square one again and you injure that joint, that disc again. So now all those variables are important from a standpoint of prevention and trying to avoid surgery, but these are also important things to understand even if you've already had surgery. And let's say you're seeing your doctor now post-surgically and you say, yes, I've already had a disc injury in the past. I'm here because now I have headaches. You have something completely unrelated. Well, if you've had a disc injury in the past and you still have a segmental problem, a postural problem, and a movement problem, you better believe that the cause of the problem has not been addressed. It's just the offending structure. Maybe that piece of the disc was surgically excised or cut out to take some pressure off of the nerve, but the joint is still not healthy. The curve or the posture is not healthy and the movement's not healthy. So guess what's going to happen to your problem? It's going to come back. Whether it's going to come back at that same level or the one above or the one below. That's why it's important no matter where you're at, no matter what the situation, whether it's pre or post, and hopefully you're getting to this before it's become a crisis, that you're addressing segment, posture, movement to really understand how to fix and maintain your discs.